Dr. Jason Wilson with Move Well. This is the Friday of our mobility clinic that we're doing. It's called Movement Matters. Wednesday we had a clinic, and it was really cool. One of the women that was here was 84 and had questions just about independence and being able to confidently be able to get up off the floor if she fell. And we went through a series of 3 different movements. By the end of it, she was ecstatic. Simple movements like hip hinge, looking at hip mobility, being able to get over, and then being able to have the strength to stand up from the floor. But she left pretty motivated to work on that. But the thing I wanted to share here, one of the sort of test, treat, retest things that we did with a patient this week was he had mentioned that he's been doing physical therapy and working with a really great physical therapist, and on his right side he has a hip pain, low back pain, issues that the positive findings on MRI, so they're working on strength on that side. So on his left side, he's able to come up out of the chair with no issues. On the right side, can't do it. There's not enough strength. So with his heel down, can kind of get up and out. So I showed him one of the posture exercises that we've been doing, and it's from the Egoescu method. So Brian Bradley, on a podcast recently, was talking about the Egoescu method. And I'm gonna show that now and have you guys try it. This is just sort of the intro primer, 3 movements of it. But I had this patient do it this week, and then I'll show you what happened after. So, and then the other part of that too is that I've had low back SI joint pain for 2 years from a mountain bike trip. Hard mountain biking, slept on the ground, cold, wet ground. Since then, had issues on that side. I've tried a lot of things, it's gotten a lot better, but after doing this exercise, I noticed that I was waking up pain-free, which was something that wasn't happening. So the setup for it is to have your feet about fist width apart and the toes turned in about 5 degrees. So you're basically looking to make sure that the outside edge of your foot is what's pointing forward. And then you make a fist, but by curling the knuckles in like this, out to the side, thumbs forward, my shoulders are down and back, and then you're gonna do 40 circles forward. Just breathe normally. If you can breathe through your nose, probably better. So 40 circles forward, and then you'll turn over and 40 circles in reverse. And then the third piece of it is to bring knuckles to temples, and if you can, bring the elbows right together. And then we will retest that piece from the chair. He was able to get up with 1 foot, and his eyes just lit right up. He's like, what just happened there? So, cool.